Good afternoon, everyone. My name is Alan Thompson. I am the journalism program head here at Carleton University at the School of Journalism, host of this two-day symposium, Journalism in the Time of Crisis. This is our panel on covering the pandemic safely. First of all, I would just like to acknowledge that Carleton University here in Ottawa is situated on the unceded and unsurrendered territory of the Algonquin Nation. For our discussion today, we're joined by four veteran journalists who have all been thrust into pandemic coverage. Stefania Battistini is a broadcaster for the Italian station RAI News. Stefania has been covering the coronavirus pandemic in Lombardy, northern Italy, one of the hardest hit regions in the world and a place where COVID cases are again spiking. Adrian Arsenault is a senior correspondent with CBC News and has been co-host of The National since November of 2017. In September, she won the News and Documentary Emmy Award for her coverage of the Ebola virus epidemic in Liberia. I know for many of our students, Adrian is the face of Canadian foreign reporting. Erin Ellsworth writes about the Midwest out of the Chicago Bureau of the Wall Street Journal. She's covered hurricanes, wildfires, and other disasters and traumas nationwide, and now COVID-19. Indeed, when we spoke earlier this week, she showed me the workspace she has converted into a storage unit for her pandemic coverage supplies. Finally, Paula Frey is a South African journalist, entrepreneur, and media development trainer. She was the first female editor of South Africa's Saturday Star newspaper. In 2005, she founded a private company, Frey Intermedia, of which she's the CEO, to improve journalistic standards, and that work has involved her in training African journalists to cover COVID. Now, our focus is on how journalists can cover the pandemic safely. I've asked our panelists to talk about the logistics of doing that, what has been involved, how it changes the way you do your work, and how it changes the journalism. I've done a little bit of hostile environment reporting myself and have taught on journalism and conflict and how in wartime it can change the reporting. We sense the pressure to be on the team. We're part of the war effort. Journalists often get dragooned into the war effort when we have troops deployed. So how does that translate in a pandemic? Are we supposed to be supporting the war effort, so to speak, against the enemy? Or is it even more important than ever for us to be critical, to find fault when fault exists? Most of all, I have asked our panelists to speak from their personal experience. How has the pandemic changed your journalism? How has it changed journalism, your reporting, your ability to tell the story? So I think we will begin with Stefania, and I have asked each of our panelists if they could speak for 10 minutes or so about their experience, and then we'll have time to compare notes and discuss, and I'll be watching the Q&A panel, which those who are watching on Socio, you'll see this in the bottom. You'll have a chance to pose a question. So Stefania, if you could go ahead, please.
Yeah. Good afternoon. First of all, I'm delighted to be with you today and share my opinion and listen to yours. I'm a reporter for RAI, the Italian public broadcaster, and I've been covering the pandemic in Italy since the first day, in particular in Lombardy, in northern Italy, one of the hittest regions in the world. The purpose of my speech is to talk about a new kind of risk linked to my profession. Well, when it comes to risk linked to COVID-19 in journalism, we should wonder which kind of risk we are going to take. That's not about death only, but let's start with the health, because we risk going down with the virus during our daily routine. In Italy, the pandemic started officially on 22nd of February, actually on 21 at midnight, when the medical staff with a great insight decided to swab a young man named Mattia Maestri, 38 years old, who became well known as #1 patient, who had just run a marathon, and apparently he was healthy. In fact, he had a COVID-19 bilateral interstitial pneumonia. That day, without being without being aware of it at all, the way of doing journalism totally changed. I'd like to sum up these changes. First of all, practical changes. We began to wear masks and gloves all day long, using roads to lengthen mics and respect social distances on a daily basis. Now we can see the first video I choose, we can see hotel COVID. I'll show you what does it mean, you know very well, entering a hospital for a journalist who works every day in the field. That's the end of March. We enter a COVID hotel where there were still positive patients released from hospitals. You can see the kind of clothes. We had to wear these uniforms as if we had to protect ourselves from a bacteria attack. They're the same as those used inside infectious disease ward in case of Ebola. Double gloves, rubber boots, diving masks to protect our eyes. But we got used. Now it's a daily routine. In my opinion, the real issues at this moment is that companies must always guarantee in stock PPE, personal protective equipment. Looking for the true in places became dangerous. It's the second item. We are obliged to chase news and truth, let me say, different kinds of truth. In sites where the aggressiveness of the virus was, but still is, higher, such as hospital, morgues, cemeteries, and so on, you all have clear in mind, the great number of military tanks. Removing coffins because crematoria were no longer able to keep up with them anymore. This is the second video. Let me show you the shooting of that day. It was the end of March. You can see the long queue. Oh, it's almost ready. The famous queue of military tanks removing 65 coffins from cemetery of Bergamo. This took place before the eyes of Bergamo citizens who were totally unaware of the situation. It was a great shock. It was even tough to tell it. We discovered this image on Twitter the day before, so we tried to find evidence. We called institutional sources, the army and the mayor to understand what was going on. This image has become the symbol of a tragedy lived in North Italy. I can't hide from you that someone tried to say that it was inappropriate to disclose those images because they wouldn't upset children, triggering panic, a kind of pressure which didn't get obviously any results. 1 month later, in Bergamo, there were still military tanks removing coffins from a church. It was one of the latest loads. You'll see how military streets corpses before all citizen eyes. They were wearing white uniforms similar to those used to protect oneself from a bacteria attack. The third point is difficult reporting. As a result, this situation, the need for protecting oneself so much has decreased the space of inquiry about the power. Definitely the space for investigative journalism, especially for who works in the front line, is increasingly restricted for several reasons. Number one, authorizations. It's more and more difficult to access the places where a lighthouse should be lit and where we should inquire. It's getting harder and harder to verify situations with your own eyes. For example, today, an authorization is required to enter a hospital. More and more often, region governors whom healthcare depend on are likely to deny this permission and prevent medical staff from being interviewed. The excuse of infection risks becoming a means to ban entry, and this is really, really worrying here in Italy. Another video, as you can see, here we sneaked into a hospital in the Bergamo area where a local outbreak was born. This nurse told us at the end of March, we are on our knees. Patients are dying all the time. We are forced to make choices. We chose who to treat and who not. That happened because of exhausted oxygen helmets and lacking beds in intensive care. This point about authorization is today trickier and trickier with a lot of pitfalls. It's getting more and more difficult to ask questions because of the danger of getting infected. For example, in Lombardy, the governor is accused of favoring his family business in the sale of white coats during the emergency. During the lockdown, it was difficult to ask questions because journalists couldn't physically go into the press room. But at the same time, they are forced to listen to a one-way communication with no possibility of interacting with their crisis unit in the region. It was impossible to ask about white coats. The pandemic has given politicians a great chance of getting around questions. So on the pretext of the risk of infection, it's forbidden entering the place on whom we had to investigate. For example, the Bergamo Public Prosecutor Office is investigating a hospital where many positives were found in February. At first, the emergency room was immediately closed, but after 3 hours was reopened upon order. On second thoughts, we can say that this behavior has contributed remarkably to determine Bergamo as one of the deadliest clusters in Europe. While I was walking around hospital to get answer, a physician asking for anonymity told me that it was politics that decided, ordering the reopening despite the opposition of doctors and virologists. This account of the facts was later found by the prosecutor's office. I should tell you the pressure to make me disclose the name of the source, and the insults from the politics claiming that sources with a covered face couldn't be used in a news report. However, this is a well-known dynamic also before COVID. And 2 hours ago, the news, now that person who decided to reopen the hospital is officially under investigation. This is the big problem we had to face during this month. The last item is connected with that. It's trickier and trickier to talk to sources guaranteeing anonymity. And in addition, during the lockdown, there were fewer journalists. It was almost impossible for freelance journalists to get permission to move around the country. So in my point of view, fewer journalists means fewer watchdogs. That's to say democratic deficit. And this is the danger also still now.
Thanks, Stefania. It makes me realize, listening to your presentation, how much all of these topics are interwoven. Over the course of 2 days, we have panels on mental health issues. We have panels, this one on the safety of journalists. We had a panel this morning on the role of a watchdog versus being a megaphone for the government. And we have another panel this afternoon on press freedom and the restrictions on press freedom in the name of COVID. And you've touched on all of those things in one presentation.
So now let's go to Adrian and hear from you, Adrian, and then we'll proceed from there.
Sure. Hey, thank you, Alan. I just want to mention something. You talked about an Emmy in September. It was a September, not this one. It was quite a few years ago. If we'd had an Ebola outbreak as well of COVID, I think I just would have crawled into bed and taken a pass on the rest of 2020. But that Ebola experience has been personally very, very helpful in this. And Stefania, listening to you, it reminds me of how much of the reporting in the early days from Italy really informed how people oceans away felt, and the sober reporting, the frank doctors. I remember those stories about doctors having to make decisions about who to save. That rippled across the world. I think it landed in newsrooms and it landed in living rooms, and it sort of set the tone for what was all coming to us. And so I think part of why people took COVID so seriously, certainly in this country, in Canada in the early days, is in part because of what we learned from your experience. And I think that has been an interesting journalistic phenomenon of COVID, is watching the lessons ripple across the planet. You talked about February 22nd as being a key date for you, 21st or 22nd. For us, it was March 9th. That was when Canada recorded its first COVID-19 death. And then things moved really quickly here. For the Canadians listening, you know this, humor me going through the timeline here. It was March 11th, right, that the WHO declared the pandemic. One of the weirdest days I've certainly ever encountered for the way energy and tone shifted. The program I work for, The National, our first show is live on the air at 9 p.m. In the course of 1 hour, Trump declared the travel ban. We knew the pandemic had just been declared. The NBA canceled its season. Tom Hanks announced that he had COVID. It was a day when the penny dropped for a lot of people. I was on a plane the next morning to Johns Hopkins because in terms of the world of learning about COVID, Johns Hopkins had run a simulation in October of 2019 on a fictional coronavirus and how the world would respond. And they invited airlines and hotels and directors of CDCs around the world. And so listening to this man talk, Dr. Eric Toner, who ran it, he, like the reporting in Italy, set the course for what was coming. Service industries may very well collapse. You will see a surge in bankruptcies. The airlines won't be able to handle it. There will be pushback against public health measures. There will be xenophobia. There will be stigmatization of the sick. I mean, it was like a horrifying conversation, but it was very clear that this was coming. And so, for people in the early days, the obsession here initially was about touch, if everyone recalls that. So our microphones, again, Stefania, the way you talked about it, our microphones were on these very long sticks. Everything was washed down. The Ebola protocols that we needed in Liberia in 2014 were sort of brought out and spread to everyone. One of the things we learned then was that you practice not moving your hands above your shoulders, because then they get to your face. So everybody was walking around, trying not to move their hands above their shoulders, gloves, wiping everything down, not traveling in the same vehicle. All of those protocols came into place. And immediately we saw what you saw, Stefania, which is this is a profession where people are hardwired to get close, and we necessarily had to be far apart. And there is a detachment with distance that was and continues to be very tricky. It goes against every impulse of a journalist. You just want to get in close and listen to people, and we can't. And so it became very hard to tell these stories. Visually, COVID is a very difficult story to tell. It is actually probably a print story. And I see Stefania going, yes. It is very hard to show endless pictures of guilty buildings and masks and people from behind glass. Bringing people closer in the storytelling has been very difficult for us, and I think we're still learning it. We're also realizing that there's been a journalistic transformation. And as hungry as people were in the very beginning, because this was so new, to get a sense of how other countries were faring. What are Italy's numbers today, for example? When the virus came to everyone else's country, the focus shifted. So in Canada, it became a domestic concern and very quickly became a hyper-local one. So if the Canadians on the line here think about their own viewing patterns, when the Prime Minister used to deliver these news conferences every day at 11 o'clock, and everyone would watch because this was a Canadian story. And then suddenly it became very hard to program because the premiers were all jumping on with their own news conferences. So the story became a provincial one. And then within the provinces, it became regional. And then the mayors were getting involved. And then we had data about postal codes. And now we're at the granular level of talking about particular spin studios or particular weddings in tiny towns. It has become so hyper local. And that is journalistically a very hard thing to keep a handle on. And where we're at in terms of that now is that hyper local rules in terms of people's interests, with going back to what's happening in the rest of the world for solutions. People are struggling with the traumas in the rest of the world, but they really want to know the good ideas for keeping restaurants safe. Erin is in Chicago. Chicago has a great design competition about how to keep outdoor restaurants functioning, right down to, do they invent, and some people have the protocols for it, heated tablecloths that then drape across the diners, to sort of like, what are the ideas? So people now are not looking to the rest of the world for a sense of scale about COVID. They're looking for it for a sense of solution. So in terms of our audience, that's what we understand what they want. But the physicality for the journalists is something we worry about a lot. And as much as I think we have a handle on keeping people physically safe, it's the mental space that I'm particularly worried about for all of our teams. I think, you become a journalist for a whole bunch of reasons. Sometimes you become a TV journalist because you love the team element of it, the idea of working together and collaborating. And this place is empty. There's like maybe 4 of us in here. It is really hard to separate people, and the isolation is starting to have an effect. And I think managers and all of us have to work harder at reaching out to our colleagues, because you can get super dark. If you pass somebody in a hallway, we all know this, you pass somebody in a hallway, you get a sense of what their life at home has been like. Has it been a hard day with the kids? Are they struggling with a parent? What's going on? Now it has to be a purposeful conversation. People are going through, there are deaths or marriages or babies being born, and your colleagues don't know or aren't there for you. So this is something we are working with. The show I host is one I host with the colleague, Andrew Chang. Normally I'm close enough that I could stick my finger in his eye when we host the show. Obviously that didn't happen. I spent 2 weeks doing the program from my backyard while he was in studio. It was an okay solution until the cameraman, masked up, gloved up, had to chase a skunk off the deck in the middle of the show. And it became very clear that one of many reasons why that wasn't a good idea. We decamped to a condo, a cameraman and I, and that's where we both worked and lived. A lot of times when we spent times in ICUs and emergency rooms with COVID patients, and the rate of exposure was unclear. Or we did ride-alongs with paramedics, and again, the rate of exposure was unclear. We just kept to ourselves as a tiny unit. So we aren't making plans here journalistically and logistically more than a few weeks at a time, because you develop one protocol and then it changes. And there is a fatigue that comes, a rule following fatigue that comes with that. We too have encountered the same problem, Stefania, that you have, whereas COVID is cover. COVID lets dictators dance, and dictators don't have to rule countries. They can sometimes rule businesses and industries as well. And so this has been required a huge push from our investigative units. Long-term care in this country, in Canada, has been a horror. in this country. We have huge problems, and we are starting to unearth a lot of what we should have figured out a long time ago as a country. So that is a big area of focus for us. And I would say journalistically too, this has been a striking time for the data journalists in our midst. Numbers, trends, visualization of those matter more in ways that I'm not sure they ever have. People now, it is culturally, it is bizarre to think that people wake up and ask, what are the numbers today? And we all know what they're talking about. We have to choose, we have to understand which numbers are useful, which ones are no longer useful, but they need help visualizing that. And that is something, an area we're trying to focus on. We're still finessing how we handle this every day. So far, for CBC, we have had a few cases of people contracting COVID. We don't believe it's been through work. People have handled it largely pretty well, knock wood. But we know we have a long road ahead. And again, Italy, we are looking to you again as Lombardy and the rest of it go through again. We're watching and grateful for your coverage.
Great. Thanks, Adrian. Again, like Stefania, you've touched on a whole bunch of issues that are coming up in this 2-day period, and we'll come back to the detachment of distance, what that means to trying to report hyper-local. Interesting you point to how more and more of the stories are what's happening in your own neighborhood and around the corner, and yet those are the media outlets that have been devastated by COVID, and we're already on their last legs. And so there's that dynamic. The journalism fatigue. We had some really interesting data this morning from Richard Fletcher at Reuters. Trust in media and use of media, of course, just spiked early on, March, April. And then it started to go back to normal levels. People were losing interest. Now other stories, Black Lives Matter, other major international stories, again, came back onto the news agenda. If somebody knows the Italian word for skunk, maybe you could put it in the question field so that I can pass it on to Stefania, because I'm not sure when Adrian referred to the skunk confronting her cameraman, if that translated. In any event, Erin, if you could join us now and share your presentation.
Hello all. So I have not been back to the office since mid-March. I haven't worked with all of my colleagues since then. As you see behind me is the guest room closet that I converted into my office space, and gear closet. You'll see some of my hard hats and my fire helmet and my masks back there. And so I cover disaster regularly. So I actually came to the pandemic from major flooding in Mississippi. And right before the pandemic started, I actually handled a mass shooting and a police shooting. So when we saw this, starting to hit outside of China, starting to hit Italy and elsewhere in Europe, I basically turned to a colleague, and we're both preppers, and we said, gear up, gear up. And we basically went to all the hardware stores where I normally buy the N95s that I usually just have to use for wildfires. We bought as many of the N95s as we could find. I started adding Tyvek suits and booties to cover my shoes in case I needed to go to a hospital or go somewhere where infection was prevalent. And, I didn't really know how to cover the spread of disease. So I initially called Granger, which is a medical supply company, and basically said, help, what do I do? What do I need? Just like, I'm a journalist and I know I'm gonna need to tell this story. How do I do it? And so they very kindly walked me through what to buy, including medical grade sanitation wipes, what percentage of alcohol I needed in my hand sanitizer, all of that kind of stuff. And so a lot of my job covering disaster, and this very much applies to the pandemic, is a lot about logistics and how to safely outfit myself so that I can do on the ground reporting still. We are still doing on the ground reporting in certain circumstances. We're being much more selective about that. But it's about knowing essentially what to wear, what to bring with me beyond my notepad and my cell phones and my laptop. So, and that's become even more important as we've started to cover other types of stories on top of the pandemic. So, you know, right now, George Floyd is my story. Jacob Blake and Kyle Rittenhouse are my story. The alleged plot to kidnap the Michigan governor, that's my story. And I've got to go out and be on the ground for all of those. And so it's remembering that when I pack things like my gas mask for a riot, that I have also got to bring, you know, my N95s or this nice little mask, which is like a step up. It's a P100. And then remembering also to take all the hand sanitizer and wipes so that I can, you know, clean that stuff off and keep myself safe. You know, and then just for daily reporting, one of these usually gets me through. But so, you know, gearing up, the extra gear is something I had to learn. And then after that, it was figuring out how to connect with people if I couldn't be on the ground. I mean, disaster reporting is so much about being in a place and witnessing whatever destruction or trauma or event is happening, right? And connecting with people in those places. We haven't always been able to do that in this instance because it hasn't always been safe. And so learning how to use platforms like this, like Zoom, like Google Hangouts, like Skype, to conduct video interviews that let me see someone's environment, let me see their hand gestures, let me witness their emotion if they start to, you know, cry or tear up, or you know, their face scrunches up in anger. All of those things help me do what I might do in person. It's not as good, but it's something, right? And then also learning how to follow the paper trail even more, or how to ask for documentation so that you can verify things that you might otherwise normally be able to see or witness in person. So, you know, if someone has told me that they're sick, but I can't see that they're sick, I can ask, did you go to the hospital? Did you talk to a doctor? Do you have a medical record that I might be able to see? And I find that telling people, hey, listen, I'm not going to, you know, necessarily publish your personal information, but this just helps me verify that these things happen. And it's usually like, listen, it's not that I distrust you, but there are people out there who, you know, don't always tell the truth. And so I have to ask this of everyone. But also, you know, aside from medical documents, it's also asking people things like, hey, do you have a photo or a video? Hey, people who were on the cruise ships that got coronavirus, did you happen to take vacation video? I would love to see it. It helps you rebuild those critical moments, right? Do the reporting even when you can't be there. And so I think those are, you know, two of the biggest changes that I've experienced. The third is that I'm stuck here by myself. I live by myself. Well, I live with my dog. She's very cute, but she's not a human being. And on top of that, when I come back from reporting, if I have been in the field, I'm still in the middle of a crisis, right? Like before this year, if I went to a wildfire or a hurricane or a mass shooting, when I came home, I was out of the disaster zone. I had time to breathe and recharge and like emotionally recover. And now I come back from riots in Minneapolis and Wisconsin, and instead of being able to step back, I'm still in the middle of a pandemic. And so I think we need to be very conscious as we do this work that it's so much harder to do the necessary self-care that comes with this reporting. You know, I've started talking to a psychologist more. I reach out to my colleagues more because we need to be able to talk about this and connect with people, even if we can't do that connecting in person. And just acknowledge that this is stressful, traumatizing work, not just for the people that we are reporting on, but for us. And I think I'll leave that there.
Okay. Thank you. Thank you very much. And Aaron, I mean, you remind me of the importance of training. So you have come to this kind of reporting with a significant amount of training, experience, equipment, the wherewithal for the 4 different types of masks that you've deployed. We're going to come to that in a moment with Paula. And also, Stefania, I just wanted to let you know that someone has helpfully told me that the animal that went into Adrian's garden that caused her cameraman to have to run away was a mofetta. Mofetta? A skunk is, I think that's the version that's my Italian's not great. So in any event, thank you very much, Aaron. Now let's proceed to Paula, who worked as a reporter, as a journalist, but also now comes to this from the point of view of somebody involved on the training side. So I think there's a good segue from Aaron.
Okay. Thank you very much, Alan. And it's really been useful to be listening to everyone speak about their experiences, because I think that a lot of what we've learned during the pandemic is really how much we need to be listening to other people's experiences and learning from what they've been able to do. I'm based in Johannesburg, South Africa, and at the moment, this country has about just over 708,000 confirmed cases. We've got about 18,656 confirmed deaths, although obviously we think that it might be much higher than that. And we literally are just slightly less than half of the entire continent's COVID cases. I mean, we've got 1.6 million confirmed cases in Africa. We've got about 38,000, almost 39,000 deaths. And so you can see that South Africa really has borne the brunt of the pandemic today. I mean, part of it might be that our counting is much better, but certainly we know that the caseload here has been very high. So in early March, long before the first South African actually was reported positive, someone who actually, Stefania, returned from Italy, from holiday in Italy, we actually brought together a whole lot of journalists to think about what the lessons were that we could learn from our own experience of reporting on HIV and Ebola. And we brought health editors from across the continent and an epidemiologist who had actually worked in West Africa with the Ebola crisis. And one of the things that we realized is that health and a pandemic is never just about health. I mean, one of the reasons why we wanted to have that conversation was because I think all of us were just aware that South Africa's and Africa's fragile health systems really made us very vulnerable to an epidemic like this. And so there was a lot of concern about how we report this and how we make sure that we report it quickly and properly. So early in the pandemic, there was a lot of discussion, there was a lot of thinking about the lessons to be learned, and we worked with media houses to train journalists on how to use PPE, on how to sanitize the equipment. We helped media houses shift from lapel mics to boom mics to using selfie sticks when recording. And generally, I'm looking at how do we practice physical distancing while producing intimate journalism. And here's the difficulty and the challenge that when we talk about safety for journalists on the continent, Africa also saw a huge shift to online news. And so huge numbers, large increases in the number of people actually getting their news online. But when you have 60% of the population that doesn't have access to the internet, when it's not possible to get the human stories by having a Zoom interview or a WhatsApp call or an SMS, then how do you actually tell the story of what's really happening on the ground? And so what it really meant was that many journalists had to get out of lockdown, had to go into communities where there was overcrowding, where there was a lack of physical distancing, where there was a lack of basic resources, whether it's sanitation, clean water, etc. And for many of the journalists who we were training, the reality is that as soon as communities saw them come in, there was such an eagerness to have their story and their difficulties reflected in mainstream media that all discussion of physical distancing just went out of the window. Right? I mean, if you're in a crowded community where people are queuing for food, how do you physically distance? When people see a camera being lifted and they desperately want their story to be told, how do you physically distance? And I think one of the big issues that I really want to touch on today is that, you know, COVID-19 was much more than just a health story. And it is still much more than a health story. It's a finance story. It's a political story. It's a gendered story. It's a corruption story in many parts of Africa. And what COVID-19 actually did was to expose South Africa's societal fault lines, right? It amplified the country's extremely high levels of inequality, and that really kind of aligns to access to resources. And it exposed it not only out in the general public, but also in newsrooms. And so very often you had better resourced media being able to provide their journalists with PPE and provide them with internet access, as opposed to other media that basically expected journalists to be able to keep themselves safe and to provide their own data for internet access. I've heard many stories of journalists who suddenly found themselves at the table, at the diary meeting, at the discussions because they had access to the internet. And many journalists who worked from a newsroom suddenly find themselves being excluded from those conversations and those decision-making processes. And so in South Africa and in large parts of Africa and probably around the globe, middle-class knowledge workers were largely able to continue working from home, but it's the poor who were absolutely devastated. You know, early in the pandemic in South Africa, 2 out of 3 poor people could not afford food because the lockdown really prevented them from being able to go out and earn a daily wage. And so the poor were devastated. And the only way to tell their story was not by phoning them, not by SMSing them or WhatsApping them, but actually going out there into communities, into overcrowded communities, and actually telling that story. And so we have had issues of newsrooms, of bureaus actually having to close down and have deep cleaning because there's been an outbreak of COVID. And unfortunately, we have also had really serious illnesses, people being hospitalized, journalists being hospitalized, and unfortunately also death. And so the challenge really is because fundamentally this is what journalism is about, isn't it? That we tell the stories of those, we amplify the voices of people who are marginalized. And so I want to kind of though end this discussion certainly on a more positive note, because I think one of the things that I realized is that our experience with HIV and Ebola meant that we actually had better trained health reporters who recognized the need for the science, who recognized the need to deal with misinformation really early. I mean, South Africa has an experience with misinformation around HIV that led to unnecessary deaths before we took antiretrovirals seriously. And so journalists were a lot more cautious about following the science. And this was one of our difficulties. I think that in the initial stages of the pandemic, some of those things were changing. Information has been verified. In the initial stages, masks weren't necessarily being encouraged. Later on, we realized that, in fact, they did help to minimize it. So I think that's one of the things that we learned, that really we had really good experience about covering an epidemic, and that we actually used it in the process. I think the second thing that was really positive, and it came out of a really difficult situation. When I told you about how journalists really in the beginning were having to go out into communities, that instilled real fear, right? I mean, on two levels. There's that personal risk that you take of going out, and the risk to yourself. But there was a greater mental health impact on the risk you were bringing back to your family, that you were going out to tell a story with the real danger that you were bringing COVID back into your home. And that was the one thing. And the second thing, there was the ethical risk of, because journalists were actually essential workers, we were allowed to move around. And so there was obviously the risk that we might actually expose ourselves to COVID and take it to another community as we move from community to community. So really critical things that journalists had to grapple with. But I think one of the positive thing that I want to amplify is that I think COVID has helped us talk about mental health in the newsroom. I've been a journalist in South Africa for more than 3 decades. I was here during the transition from apartheid. And so we know in some ways that we have been exposed to post-traumatic stress disorder. But very often we ignore the less visible post-traumatic stress disorder of covering something like HIV and AIDS, right? Of covering systemic or sustained crime. And I think one of the things that I've seen in the newsrooms that I've worked with is that we are now willing to talk about the mental health impact of covering the lockdown. Not just for the reporters who go out every day and the stress of that, but the newsroom manager who has to make the difficult decision that the story is worth telling, and therefore is almost worth putting someone at risk in order to tell it. And I think that that when we step back from this pandemic, we must not lose that ability to be vulnerable about our mental health status, and to recognize that journalists particularly need to be open about that. I'm going to leave it there, and certainly I'd like to share some more later on in the discussion.
Wonderful. Thank you very much, Paula. I think, you touch on the disproportionate impact of COVID. It's been very striking in North America, the disproportionate racialized impact of COVID as a story. And yet these are stories that have to be told in the community, so that do compromise safety. And so in the old journalistic metaphor, that we are the ones who have to run towards the danger to do the job and to tell the story. So if our frame has been talking about how to do this safely, but the self-care, and Aaron referred to this directly. So I'll take that opening to ask a difficult question, and maybe Aaron can start first. I am curious to know, because of the situations that you have been in, what are you doing about your own self-care and your own mental health, if you're willing to share that?
Oh, I'm always willing to share that. I think it's one of the most important things to share as a disaster reporter. So I have a psychologist. Her name's Colleen. She's very nice. I talk to her once a month. And we talk, she specializes in PTSD, stress and anxiety, with an emphasis on workplace. So kind of perfect. And she's worked with other journalists in the past. I think if this is something that you do regularly, and right now it's something that we're all doing regularly, having a professional to talk to is really, really great. And so I'm a big advocate for, having having a psychologist if you can. Aside from that, I have a network of friends, colleagues, mentors, and just non-journalism friends that I feel comfortable talking with about the stress that I'm under, and they help me just sort of release some of what I've experienced. I have a really good journalism friend who also covers disaster, so we often commiserate and just share and talk about what we're going through. I don't really talk to my parents because, let's be honest, what I do scares them. So I don't go and tell my mom, "Hey mom, I stood on the edge of a wildfire today." She usually finds that out from Instagram, which is probably not great, but it is what it is. And then I run. And actually I haven't been running outside because of the pandemic, so like I just bought myself this handy dandy treadmill over here. Yeah. And so I run, I cook, I pet the dog a lot. She's pretty great as a stress reliever. But yeah, that's and the other thing, I have gotten much better about telling my bosses. I mean, you're right, Paula, when you say that it has made this easier to talk about in the newsroom, because quite frankly, before this, I was kind of the oddball out, like the girl who really likes to go to disasters and doesn't mind, having to wear the PPE. And everyone just thought I was very strange. And now, because they're all going through it with me, it's become much easier to talk about like how stressed I am, how weird it feels to come out of a disaster zone and go back to normal life, and that sort of disconnect that happens. And so I've been able to open up more to my bosses about like, hey, listen, I just covered riots for 3 months straight, and the crazy racist reader emails that we get because of that are really emotionally traumatizing for me, and I need a break. Can we move me to some other trauma so that I don't have to deal with the racism every single day for at least a couple of weeks, kind of thing. So yeah.
Anyone else on mental health and self-care?
If I can, I experienced the same situation Erin told, and I feel the same pain. I saw a lot of pain in your eyes when you told that stories. That make me feel better. When you see a lot of people who suffer like that, for example, the first month in Bergamo, emergency number didn't manage to answer all calls, so that people died at home without any kind of assistance. A lot of general practitioners didn't have tools and equipment to treat patients. There were PPs, and a lot of doctors and nurses died while doing their job. Hospital emergencies were overcrowded, and a lot of people weren't allowed to enter. It had been a nightmare. It's almost impossible to share the pain and to tell the country that stories, because you have to find a balance between some institutions. We face two opposite behaviors. There were some institutions had to play down the situations to avoid panic, and it's at the same time there were a lot of institutions had to emphasize the situation to raise the citizen awareness. And you are in the middle, and you have to tell the truth. So it's difficult also to find a balance between these two opposite behaviors.
Can I just jump in here a little bit as well? I think all working journalists hear echoes of their lives and everything you're all saying. For many years, I was based in the Middle East, and you go to a place like Syria, and I had a routine where I'd come back and I would say to the stories that they were allowed to follow me for a little bit, but there'd be a time when I'd turn and I'd tell them that I needed to leave them behind. And we relied very heavily on a couple things. One, the camaraderie of our teams, our tight teams that you're on the road with, the capacity to write out the trauma, like to the act of writing a story is a privilege, in that everything sometimes you feel you give back into the story. But also as a journalist who spent most of her career going to sort of disasters and traumas and conflicts, that we were trained for that. And what has been really hard for COVID is realizing that people who didn't sign up for that, who did not sign up for being faced with trauma, it came to them. And so it came to their local newsrooms, and it came to reporters who maybe never wanted to experience that, didn't have the training for that. The notion of a hostile environment, of coping with a hostile environment, was traditionally something that when there was training in a newsroom, it was almost exclusively for people who were going somewhere. And I think this has taught a lot of newsrooms that training has to be applied for people every day, whether it is a demonstration like the one that Erin is talking about, where it gets so fraught and so angry and so emotional and you feel so trapped and helpless, or whether it is talking to an elderly woman. Like, one of the hardest things for me as someone, I sort of like to think I'm okay, but one of the hardest things I did was talk to an old lady through a window who was in a nursing home, who hadn't seen her family, and she was crying, and there wasn't a damn thing I could do about it, other than to say, I'm sure your kids love you, and how proud they must be of you. I don't even know what I was saying at some point, but I couldn't get there. And I think that kind of experience is sticking with people who've never had it before. And this is what I'm actually I'm worried about, how robust people will be after this, when they maybe just go home to themselves. It's super hard.
I mean, one of the things that I'm finding consistently is that because for a lot of the journalists who are working from home, the day never ends, and the exposure to the story, to COVID-19, never ends. So before, you would go to the office and you would do your day's work, and that ride home would just be where you cut yourself off from the story that you've been covering all day. But the story never ends. You wake up in the morning and you're doing the story, and you work all day in the same space that you're living in, and you're doing the story. And I think when it comes to self-care, I mean, it really is something that we need to be quite intentional about. And if we're newsroom managers, we need to be quite intentional about checking in with our colleagues and making sure that they are in fact putting up personal boundaries in terms of when they stop working during their day.
I want to throw one last thought that Paula just reminded me about, and I think we've all articulated it without actually saying it, which is that we are victims and survivors of this disaster. And so as journalists, we're not usually those things. We get to, again, leave at the end of the day, but we're in it.
Do you have any concern? I mean, I have heard from some employers in terms of, will we ever go back to the way we covered stories before? I mean, Adrian was talking about the camaraderie, the meeting your colleagues in the hallway, working as a team. We can't do that during COVID, but I do wonder if news organizations might come to think, people can do this job pretty well on their own, at home, online. Maybe we could save a lot of money by not having hundreds of people in newsrooms and going out to the scene. Like, we're adaptive and resilient and have found ways to do these stories in difficult circumstances. Do you have any fear that some of this might become the new normal, that we can't go back to the way we used to do journalism?
Oh, hell yeah. And I think for every reason that Stefania and Paula and Aaron said, verification, the dictators, their love of darkness, you just don't know till you go. I still believe that phenomenon of not knowing till you go is something that we will have to fight even harder for. Now, it might be the case, I think that there are no snacks left in here, by the way. I've looked at every drawer, I've eaten everything. It may be the case that large newsrooms, some functions can be done from home and will continue to be done from home for a while, and maybe that's okay. I have lots of colleagues who say this is the best time of their lives. They've never had such good work-life balance, but I think we are about to have a whole bunch of fights here about finding way, maybe not to dip in and out of a story as frequently as we did, but going to a place and committing to it for a set amount of time, as in a pocket bureau experience, and then leaving it. Like there might not be this much stuff going on, but there might be wholesale 3 months here, go, then come back. I think we're gonna have to change how we think of deployments, I think. I really think.
Anyone else on that subject?
Yeah, I'll say this. I mean, we're being told at the Journal that we're not going back to the office in any real form until at least January, right? And then that will be on a voluntary basis. I don't think, and there are fears and some celebration about being able to work from home longer, about some offices, some of our smaller locations closing because we've realized that we don't really need them. But there is also a lot of discussion about how in-person interaction is essential to news reporting operations, not just the reporting part of it, but just the collegial newsroom feel too, because so many ideas come up from bumping into your colleagues and talking to them in the office. So figuring out how, even as we evolve perhaps to, a little bit more separate way of working, how we keep that camaraderie going as well. And I will say this, it's true that I don't see most of my colleagues, but we, especially with the protest and riot coverage, we work in pairs. So it's not that I'm, completely alone. I'm not deploying as a solo journalist, but it's very much being with, one or two journalists. And I think that is a way that we will maintain some of those connections. But yes, we do have to sort of think of it as like that pod bureau environment and figure out, how to keep ourselves safe within that.
I do think, Alan, that we really have had a convergence of crises, right? So we've got the disinformation, the misinformation crisis, we've got the economic crisis, and then we've got this pandemic, and all of these things have really come together and hit media, certainly media across the African continent, really, really hard. And I think it will fundamentally change the way we tell our stories. But I am concerned. I'm concerned because, one of the most obvious things is interns, junior reporters. How you learn the craft, right? If you're not shadowing someone with more experience, if you're sitting in an environment, Zoom can only do so much. And I think one of the things that we need to begin to think about now, or what are the safety protocols that become part and parcel of our lives? What are the things, even now, wiping your hands. When I walk into our office, the first thing I do is take my temperature. I always have a mask on unless I'm sitting in my closed office. I'm always, when I come in and out of the office, I'm always I'm using hand sanitizer. So I think we really need to begin to think journalistically, what are the protocols that we need to put in place in order to make our journalists safer? But we cannot kind of look at this as a long-term solution. And I think part of the reason why we're doing that is financial. that we know enough about COVID-19 now to be able to operate a lot more safer than we were at the beginning. But it's the economic imperatives are kind of forcing us to push on in the way that we are. And I think there's a cost.
Paula, can I ask you a question in terms of training and stuff? I know that in a number of industries, your point about interns is great, that people are saying that how on earth do new hires who, you know, have no social capital already built up get their voices heard? How does anybody learn to trust them? How are you finding like that meetings are happening? Because when you're all in person, a good leader can spot when someone is a bit shy to break in and can say, you look like you have something to say. But I'm hearing from lots of people that old habits are emerging again, right? That people are being talked over, that there's a bit of sort of bullying sometimes. I'm not talking about this place. I'm talking about generally in newsrooms and other high stress places, that old habits are emerging. Things we thought we dealt with in the past, they just come back in COVID. So how are you talking to people who are leaders in newsrooms about how to sort of give voice to people who might be a bit shy about it?
Yeah. You know, and very often that's also exacerbated by whether you have a pay-as-you-go phone and you're putting data into your phone all the time, or whether you have access to Wi-Fi and so you're working from home, and so you can actually be on the Zoom call and you can have a voice, and you can have a voice that can be talked over if that's what's going to happen. I think that newsroom managers actually, I mean, I've spoken to quite a number, and I think that they are aware of the fact that the distance makes it more difficult to spot when people are not feeling well, are not doing well, etc. And so I think people are mindful of that. But you're right, you know, as this becomes the new normal, we're going to find ourselves replicating the status quo from before the lockdown in the online world. And I suppose it's an opportunity for us to just rethink the way we're going to do journalism in this new normal.
I know we've been talking. Oh, go ahead, Stefania.
One of the greatest lack here we lived is the lack of data journalism. One of the challenges to create teams of journalists experienced in data journalism and hand-on professionals. This lack, in my opinion, has contributed to determine the rise of denial movements. Being a journalist in a social age is a great challenge, in particular in the light of the growth in denial movements, rejecting science to supporting rational disease without providing evidence and verify their claims. So we should try to improve here in Italy, data journalists for who, like me, works every day in the field. I think it's a competence that I miss.
And we have a panel on that this afternoon. So when you get off this one, you can check it out. I mean, we're talking about safety and the growing awareness thrust upon us of the need for equipment, for training, self-care. But I wanted to ask you to go back and reflect on something that you've each kind of alluded to, which is the safety concerns that we should have for those who we're covering, the sort of trauma awareness. And how do we get around that? Like, I know, so Adrian, the elderly lady that you're trying to communicate with through the window, at a certain point, what's the trauma that she's experiencing? And it's inevitable, you know, because of what we do when we're in this environment, doing our work in a safe way. What about the people that we're reporting on who are really experiencing this trauma?
Listen, I think it's a very valid question. I think it has to be a question. It doesn't matter the story, that whoever you're talking to, whoever story you're sharing, it is just built into the foundation of ethical journalism that the impact on them has to be considered and has to be respected. You know, in the case of this lady, there was a paramedic who was up in the room with her, who was, we were doing a story on the paramedics actually, and he was giving her a, you know, a COVID test and connecting with her, and she came to the window, and that's where we had the conversation. And I knew from talking to him that she, you know, she was ultimately okay, but a whole bunch of people are not okay. You know, we are talking to people, our journalists are talking to people, especially elderly people. This has been such a huge problem in Canada. And what worries me ethically is that we talk about them a lot without hearing from them a lot, and that it others them. You know, there are elderly people who, just because they're in a nursing home doesn't mean they don't have the wherewithal to perfectly articulate what is happening. But there's a whole conversation happening about them because it's too hard to get their perspective. And I think denying them a voice is as ethically problematic as the other scenario. So I think there are ethical challenges. There are ethical minefields here that we hadn't considered. The act of wearing a mask in the early days, when we were being told there weren't many masks, like when we went into a hospital and the hospital didn't have enough supplies for its doctors and nurses, we sure as hell were not going to take one of their masks, right? So we are sometimes issued N95s, bit of a prepper. I think it's in the gene, just like Aaron. So the cameraman and I, Jared, we each had our own N95s, and I asked, are we okay to wear this? Like, will it bother anybody that we wear this here? And glasses. No, you're fine. But I got letters like you would not believe. How dare you? How dare you not donate that N95? How dare you wear it? You know, it's hard. It's hard to be accused of how dare you go into a hospital when families can't. Good point. But we needed to show to Canadians what it was like, and the hospital wanted us there. And I tell you, the patients, you know, the ones we were able to speak with, were certainly happy to have us there. But the letters, you know, the ethical minefield of this is really hard to navigate.
I remind people that in these instances, they should often think of journalists like first responders. Because if we're not out there getting the information, how are they going to receive that information? How are they going to know what's going on unless someone like us is out there telling them? And I think in some ways this is about journalism awareness in terms of those types of letters where it's like, hey, we're not going to everything and just using N95s willy-nilly, but we're making hard decisions about what assignments absolutely need to be told in a way that will use this critical, hard to find gear. So that's what I would say there. On the ethical question, talking to people in person, I always hope that when I'm talking to someone who is in the middle of a trauma situation, that our conversation is going to act as a release valve for them, maybe be something a little bit cathartic. And I always have to remind myself that I have to evaluate very quickly whether someone is even up for talking to me, whether they have the emotional bandwidth. And if they don't, then I have to walk away. I have to walk away. Because my job is to get the story, yes, but my job is not to add to trauma. And so if I'm going to add to trauma, I've got to step back. And that's okay. You can step back and go find someone else. There's going to be someone who is able to talk to you. But if someone isn't, just leave them be. And when someone is willing to talk to you, you've still got to do that assessment because they might not know that they are not in the right state. So you've still got to sort of ask yourself and question your gut on that. And then even before a discussion begins, even before an interview begins, ask them for permission. always ask for permission, and ask it a couple of times, because, you know, people, like, their feeling might change in the middle of a conversation. And offer them agency, because so many of these people that we're reporting on, they've had control just ripped from them, right? And so you want to give them some of that control back. And I do that by reminding people that, you know, I can ask lots of questions. They don't have to answer them. And that our conversation goes two ways, that if they don't think I'm asking the right thing or headed in the right direction, that they are more than welcome to, you know, guide me there, tell me what they think I should know. And quite frankly, I also give people an out. And this actually helps them open up more. But I tell them, you know, if at any point you need to stop, or you rethink something and don't want this on the record, or if at the end of this conversation you're just like, you know what, that's more than I was really expecting and I'm not cool, like, you can take it back. You don't have to answer the question. We can stop, whatever it is. But in that way, because I do that, a lot of times people feel more comfortable speaking, because they know that they don't have to tell me everything if they don't want to. So.
One of the things that we learned from HIV and even Ebola, and I think Adrian can attest to this, is just what role journalists can play in mitigating stigma and actually just stigmatizing people. And certainly in the early days of COVID, when everyone was trying to look at who was positive and who wasn't positive, I think journalists had a real ethical challenge in terms of how do you tell the story in a way that you keep other people safe, but that you also don't contribute to stigma. And I think even now that issue still exists, in terms of that we need to be constantly thinking about whether in fact the way we're writing our story stigmatizes the protagonist in our story, or whether we're actually reducing stigma.
We have about 10 minutes. I wanted to ask each of you, and maybe we'll go in the order that in which we began. And Stefania, with you first. I mean, hopefully this will come to an end. We're hoping that we will reach the post-pandemic period. What do you think is the most important lesson for journalism from this period that we have just experienced? Oh, I think your microphone is still muted.
Sorry. Yes, I think maybe the older things, just to go to the places, verify, check, tell the truth, never be seduced by power, never give up walking, and stand with your boots into the ground. The same things before pandemic, but stricter and determined to check news, because it's always more and more difficult to verify, to verify with your own eyes. So the most important thing I learned is that I have to be rational and try to listen to people, and that it's the same job as before, but I ask to myself just to be more rational. And when I said never give up walking and staying with your boots into the ground, is because for me it had been the most difficult I lived, because our dad said, don't go there, it's dangerous, don't do that, it's dangerous, don't leave that situation, be aware of that. It's always no. It's like come dire, è stata una conquista, riconquistarsi gli spazi. It's like it was important just to get our spaces again. Here in Italy, anyway, the situation is getting worse because we are France and Great Britain with a very bad curves. So it's not post-pandemic here. We are waiting for another wave. So we feel the same air as in May, in June. So we are a little bit in the same situation.
Adrian.
Again, you know, it's so nice to talk with you guys. Like, I feel like there is somewhere a chip, like a DNA thing that is shared, and it's kind of lovely to hear about boots on the ground. I think it means a lot to all of us. I also think that you come out of this reminded, it's not a new learning, but you're reminded that trust is not guaranteed, but it is available. People have shown that they are prepared to trust journalism, but it has to be earned and re-earned every day. And that it comes with transparency. It comes with like showing your work, not just saying X number of people have done this. You have to show how you got there, and you have to keep pushing the transparency and keep bringing people into the idea that the learnings on something like COVID are changing. You know, they're changing as the world goes through this. We will go through it with you, you know, but just reinforcing the need to constantly earn that trust, because once it's gone, it is really hard to get back.
Thanks. Erin.
I think it's two things. One, a reminder not to be complacent. We know that, and to constantly be thinking about how we need to evolve or change to address whatever challenges reporting throws at us. Because I don't think any of us thought, gosh, a pandemic is right around the corner. You know, I mean, I routinely go to disaster, and I thought, gosh, I'm prepared for, you know, pretty much everything except a pandemic. So just a reminder that we constantly need to be thinking, how can I do my job better? How can I do my journalism better? How can I be more empathetic, more, you know, more aware of implicit bias, of telling the story properly, and how can I take that back to my newsroom and share it with my colleagues? How can I help my industry and my craft evolve so that we are constantly being the best journalists that we can in the world that we live in?
Thanks very much. Paula.
Thanks, Alan. Today, our health minister, who is in quarantine because he has tested positive for COVID-19, issued a statement to say that the statistics are showing that the alarming increases in the number of cases in one of the regions in South Africa, in the Western Cape. So because of that, I'm going to have to go with Stefania here. I think the big lesson has been that we need to be resilient. This story is not going to go away. We need to persevere. We need to stick with this. This is not short attention span journalism. This is follow up and follow through journalism. I'm not letting go. I think it's really important. We know the pandemic really is a life and death situation. And I think journalists play a critical role in how citizens actually respond to it.
Great, thank you. I want to thank you all very much in putting together this conference, 17 panels over the course of 2 days. You know, I wanted to make sure that we touched on the question of how to cover this story safely, but even even that question obviously kind of defies definition because it goes in all directions. And we end up talking about our own safety, the safety of those that we cover, our self-care, the ethics of doing this job, the reality that probably the most important part of this story to tell is quite likely the one that is in a community where it is likely to be the most dangerous for the journalist and the most ethically fraught and perhaps the most difficult to convince the news manager that we should spend the time and take the time to do this. So thanks for touching on so many issues. And just, I want to remind you, part of the reason we're doing this in a journalism school is to share this material with journalism students and with those who are teaching journalism. So in addition to those who are attending today, and now we're above 1,000 people registered in the conference, in addition to those attending in person online, we're recording all of this. We'll be sort of repackaging all of the panels afterwards and making them available to journalism educators because we need to draw these lessons. And maybe the lesson is have some of this stuff in your closet, invest in some equipment, invest in some training, ask questions about how to do this job safely, ask questions about the ethics of interviewing people who are traumatized, and know when you need to say, I got to take a break here. I have to step back. I cannot do this anymore. And I need some other human beings around me who can help. So thank you very, very much for taking part in this. And with that, I think I will bring this to a close. And again, Stefania, Adrian, Aaron, and Paula, I just want to thank you so very, very much for joining us today.
Thank you too.
Nice to meet all you.
Thank you for having me.
Thanks a lot. Bye-bye.
Bye-bye.